This is my student support system. Keep watching, keep learning. Hello students, good evening. Today we will discuss about child health nursing. This is introductory class of child health nursing. This class I have already taken 3 years back, but now I have updated this lecture and you will see some new additions as well. So let us start class on child health nursing. You will also see the Hindi version of this lecture after this class. That is child health nursing. What is child health nursing? Child health nursing or pediatric nursing is the nursing care of neonates and children up to adolescence, namely up to 14 years of age we can say. After that the child can go to adult hospital as well, usually in an inpatient hospital or a daycare clinic or in OPD of a hospital, especially pediatric hospital. Pediatric word comes from the Greek word pedia, which means child, and iatric, which means treatment. So in pediatrics we care for the child in health as well as in illness. Pediatric nursing is a specialized area in the nursing practice concerning the care of children during wellness and illness, means health and illness, which include preventive, promotive, curative, rehabilitative care of children. What is the modern concept of child health nursing? Many times you may find a question in your exam that explain modern concept of child health nursing. The present concept of health care of children focus on prevention of illness and promotion of health rather than treatment of illness alone. So this is the base of this concept. The goal of pediatric nursing is to focus on growth and development of the children and promote on the state of health physically, mentally as well as socially, so that the child can grow and develop in a positive way, healthy lifestyle, healthy adult he can develop into. By providing effective nursing care to the children, we can minimize the psychological trauma of hospitalization, because hospitalization is a big trauma for a child, where the child may be separated from the parents and the child may feel very awkward. But in modern concept we help the child to adjust through the situation, especially during the hospitalization, and play therapy is very important during this time. So in modern concept we have introduced play therapy as well. To provide comprehensive care, we should understand the growth and development process of the child and response to the therapy. And every stage we keep in mind the growth and developmental milestones of the child while providing care to the child. As per modern concept, child health nursing, we provide child-centric and family-centric or family-involving care of the child. Parents are involved in planning, implementation of nursing care so that child can feel at home and the trauma of hospitalization is reduced. Now let us see the whole theory of modern concept can be explained by one word, that is academic. A for advocate for the child and family. In modern concept, the nurse advocates for the child and family. She is there to help always. C means communicate for the child, because she can understand the psychological or physical problem of the child, because pediatric nurse is a specialist nurse and she is able to communicate what child cannot A again activate for the child's activity. Activate the child's activity because when the child is in hospital, he may be lethargy or in stress, and naturally the child is always active. So the nurse is there in modern concept who activates the child's activity. Then for D, disseminate information about child care. Disseminate the information to parents as well as other health members of the team. Educate the public about child health. People who are in the care are motivated under this modern concept, so that they are always there to help in promoting the child's health. Then I means investigate available resources. What are available resources which can be used for the care of child? She always finds that. And C means collaborate care activity. Collaborate the care activity with the health team, collaborate the care activity with the family members. And this is the base of modern concept of child health nursing. Now let us see what are the principles of child health nursing based on which we should provide best child health nursing care. So first principle is build a working relationship with the parents and their children from the time of first contact. When the child enters in the hospital, the working environment or working relationship should be developed. The nurse should be aware that all the behaviors of parents and children are meaningful. She should not ignore any behavior of the child as well as parents. Accept the parents and children exactly as they are. Do not try to modify them or mold them. Just accept and understand. Allow them to know that their problems are important and the nurse is there to aid in their solution. Always help them that the nurse, pediatric nurse, is there who is able to understand their problem and definitely will solve it. The pediatric nurse should have empathy for the parents and children, because a nurse should understand the situation of the parents and child, that as she or he able to understand the problem of their own child, so that she can or he can empathize with the family and child. Next principle says willing to acknowledge the parents' right to their own decisions concerning their accident or their problem. Always she should acknowledge that yes, you are there who will decide the whole process of care, not any other person. Next principle is allow the parents and their children to express their emotions, even negative emotions, because they are in the situation where they are stressed. So whatever they are feeling, the nurse should always try to help them to express. Speak a language understandable to the parents and children so that they can easily understand the process of the disease and treatment, and ask questions limited to a single idea or reference at a time. Next principle says that we should have always empathy to parents and children. We have already discussed. The nurse must help to the parents to feel that there is unity among the health team, so that they can feel that yes, the family or the child is in safe hands. Pediatric nurse uses techniques like distraction, pain management and child-friendly environment while providing care to the child. Now let us see another question which can arise in the exam, that what are the trends in child health nursing? What have been changing during in last few years? So in trends we can write that now there is child-centered care. and flexibility of hours, visiting hours. High technology care is provided to the children, and yes, there is, we can make or prepare the patient support group or parent support group. And another important trend is that school teachers are also involved in the care of the hospitalized child, so that stress of study can also be reduced. Play therapy is involved in the hospital as well as in the school, and care by parents and family members, especially mother, is given prime importance, even if the child is hospitalized. Then health and nursing team collaboration is again very important, and it is given prime importance. Then evidence-based practice. Yes, the latest trend, nursing practice in pediatric is evidence-based. Prevention of disease and promotion of health is another very important trend. Now, the focus is given on prevention of illness and promotion of health rather than providing just treatment. Now, there is another very important question which we find in the exam, and these points are very important. You can remember them and you can write in every answer of the question, whether it is from a particular disease, of respiratory problem of the child, digestive system problem of the child. So these are common points which you can use while providing or while writing your answer related to nursing management of a particular disease. So first point is, in most instances the nurse is the primary person who is involved in the care of a hospitalized child. This you should keep in your mind. The nurse is first one to see the child and family and spend more time with them than other healthcare personnel. And this should be understood by the family. The nurse must try to minimize the child's distress so that hospital stay will be present and experience as possible. Next, she should be careful about providing or minimizing the bad effects of hospitalization developmentally, because if the child is in stressed condition, developmental milestones may be delayed. When addressing the fear or separation anxiety and loss of control that occur in the hospitalized child, the nurse should consider child's age and cognitive and developmental level while providing care to the child. While preparing the child or family for surgery, the parent should be allowed to stay with the child until the surgery begins, and after surgery, even in post-anesthetic area, parents should be present. The nurse should maintain safety of the child, physical safety during the hospitalization. This is very important nursing care. Provide basic care for the hospitalized child. Basic care involves general hygiene, including bathing, hair care, oral care, and nutritional care as well, involving family, especially mother. If the parents are present, allow them to provide care for the child. Just be there to help or support so that the child's stress can be reduced. Older children may perform hygiene measures themselves, but they may need some assistance from nurse or family member. Provide play therapy. Activity should be aroused, and recreation therapy for the hospitalized child, so that again stress is reduced. We should assess the factors that may influence family reaction to the child during hospitalization. Encourage families to have support system in place before, during, and hospitalization. Promote schoolwork and education during hospitalization. If the child is hospitalized for a long time, try to contact school teachers or their school friends so that they can provide study materials. The child, if able, can do their homework, and so that the stress of study can be reduced, or the child may not feel lagging behind. Then finally, prepare the child and family for discharge. Discharge planning actually begins at the time of discharge. On discharge, children and their parents receives the written instruction for the home care, and they should be well explained by the nurse. They may be given the medical record as per hospital policy, explain and demonstrate, and request a written demonstration of any treatment or procedure which is to be done at home. So this nursing management or nursing care, you can write in your answer if the question is asked. Thank you. Have a good, nice day.